Dr. Babu, and I'm the Medical Director of Celera Neuro Sciences. And today we are gathered here for an important occasion for the release of third generation Apo, pen and pump. As you are aware, when people age, they have developed neurological illness like Alzheimer's disease, dementia, right? Then Parkinsonism. Till now, there are various therapies for Parkinsonism. We will have tablets, then we have surgery. These are the two options which are available till now. So whenever a patient with Parkinsonism comes to us, we will start on tablets. After 2 or 3 years or 4 years or so, either the effectiveness of the tablet comes down, or otherwise the disease progresses, or otherwise the side effects of the tablets kicks in. So at that time, there is no control for this disease. Till now, what is the option which was available? It was only the surgery. But of course, not everybody would like to put a hole in the brain and to have a battery and also to continue with the tablets. So all these days, only these two options were available. Few years back, this apomorphine molecule has come in. So the doubt is that when can we use this apomorphine molecule? When a patient is started on oral tablet, when the effectiveness of the tablet comes down, or otherwise, if there is side effects of the tablets, then we can use this apomorphine injection. How it is delivered? Either as a pen, like your insulin pump, simple pen, right? You can take it, or otherwise as a pump, a small pump, a third generation pump, just smaller than your iPhones or your Android phones. These pumps will be delivering the apomorphine drug. So now the guidelines recommend, even before thinking of your surgery, what surgery? Deep brain stimulation, right? You have to use this apomorphine drug. So we are very clear that. So our question is that, isn't it available before? Yes, it is available for 3 years. Then what is new today? Now is an advanced delivery device. What is this advanced delivery device? The new pen and pump, which is an advanced new delivery device. This pen and pump, it is very easy to use, one, very effective, that is other thing, and moreover, it is fine-tuned delivery of this apomorphine drug. By this, the patient can control the disease. All these years, the disease is controlling the patient. Now, the patient is getting a chance to control the disease. Thank you.
I'm Dr. Vinod. I'm one of the consultants, interventional neurologist and Parkinson specialist, King's College Hospital, London, and in Dubai. I lead Advanced Parkinson Center of Excellence in King's College Hospital, London, Dubai. And also, I'm actually coming as a visiting neurologist to India and seeing some of very important patients who actually been not able to come to London or Dubai. So I'm just doing some clinics in Westminster, in Chennai. I can't travel, obviously, and I love to come to Hyderabad. Hyderabad is, I learned a lot with Rupam and Rukmini. So I've been doing this advanced therapy since last over 15 years in UK. And since I'm coming to India, and I'll tell in Telugu, last 10 years నుంచి nothing on the treatments ఇక్కడ, apart from deep brain surgery. So, ఒక్కసారి patients not getting better on oral tablets, they'll say deep brain surgery. See, మీ grandfather కానీ, మీ grandmother కానీ, Parkinson's వచ్చి 5 years తర్వాత tablets పనిచేయట్లేదంటే, it's not an option. Deep brain surgery is not an option for all patients. So, London, UK, Australia, America, all these civilized countries, we have this national, international guidelines. Guidelines ante oka rhythm andi adi. If A is not working, B works. We should try B. B is not working, we should try C. C is not working, we should try D. We can't jump from A to D. It's not ethical. So B and C options endante, pen is the B option, pump is the C option. Like మన ఇండియాలో డయాబెటీస్ చాలా కామన్. So everyone in our household has a diabetes. One in everyone has a diabetes. While insulin pump, first diabetes medicines, they start taking with oral tablets. Then if it's not getting better, we go on to the insulin pumps. We don't go for pancreatic surgery. So same thing in Parkinson's. Diabetes low, insulin is a problem. Parkinson's low, dopamine is a problem. So how we have to give dopamine is the device-aided therapies. A small example, if you want to go to Hyderabad airport, would you be happy going in Hyderabad traffic or a flyover? Flyover. So traffic is stomach. If eaten food not digested properly, the dopamine won't go to the brain. So flyover, this device-aided German technology will use that through the skin, bypassing the stomach to the brain, and every hour. So every hour you get a nice dopamine to the brain, and the patients, bedridden, wheelchair bound, advanced patients, not able to get better on oral therapies, then this is the next therapy all should use. The neurologists, we all have to use this therapy before we recommend patients to more invasive brain surgery surgery. So we don't recommend, even in Singapore, no countries recommend that. So here, because we don't have that availability, that's why we don't have a choice. That's why we're all sending patients to surgeries. And how many patients can afford and deep brain surgery Sunday? So this is a simple pen. Anyone can use it. Anyone, even you can keep that pen in a small neurology center and you can implement. And that if it works, then a diagnosis makes much better diagnosis. And the pump, if you are on pump only, the advantage is you don't need to take all the oral tablets. Pump will give the medicine. Whereas deep brain surgery, you have to still take the oral tablets. With airport low, deep brain surgery, battery, you can't go to the scanner. So a lot of things I strongly recommend. Last 15 years, we're using this with evidence-based, evidence and research papers, quality guidelines, all recommends apomorphine, pen and pump.